Welcome to this training on the role of the peer in the care process. We are sharing current examples and what we've heard in counties and different ways that peers can contribute, both in care and then in other similar activities. These are just examples. As we learn more, we hope to share more examples about how peers could contribute throughout the process in different areas. Let's take a look at our agenda for today's discussion. We have three major sections. So first, just an introduction to the role of the peer, share some evidence behind how peers can benefit this population, and then describe some of the core competencies and strategies for recruiting and retaining peers on teams. The second and third sections will really focus on the role of the peer in the care process. We'll share different possible roles for peers, again, illustrative and not limiting. And then we'll also talk about how peers can be integrated into the care process and share some examples. Some learning objectives for today. The goal is that by the end of this session, participants will have an increased ability to identify best practices for incorporating peers into the care process, identify ways that peers can be incorporated into care, and then list strategies and resources available for peer support specialists. So now I'll introduce our speakers for today's session. We are really pleased to be joined by our partners from Painted Brain, along with Deborah Rose, a clinical psychologist. So both Dave and Rachel have a lot of experience in the mental health system and integrating peers to better support individuals. Deborah Rose is a clinical psychologist by training and works for Health Management Associates and has a lot of work in assisted outpatient treatment programs and integrating and creating person-centered care. We are really pleased to be joined by these speakers today and to share their background and connect that to care. So with that introduction, I'll turn the mic over to Dave Leon to talk about the role of the peer.
Excellent. Thank you so much, Patricia, and good morning, everybody, and good afternoon to those of you that are watching this in the afternoon. I'm a social worker for the last 20 years in Los Angeles, but from the very earliest stages of my work, I've really seen the benefits and the importance of peer relationships. And the role of my own work has been often to help individuals with more severe mental health issues find peer support and find connection with other people that are dealing with sort of challenges and illnesses like themselves. So I'm really pleased to be here, and I'm excited to talk a little bit about a couple of case examples and vignettes in the next slide. So thank you, everyone, for being here. We're going to look at three different case examples throughout this training today, and we're going to be referencing back to these vignettes. The vignettes illustrate different differences in acuity level, differences in connection to the agencies that they work with, and their relationship to services and systems. And what each of them will illustrate is a different way that the peer role might alter itself to best meet the needs of that individual participant or client. So as we look at these three different categories of folks, we're going to start off with Taylor on the left. Taylor is involved in a lot of risky situations and is mistrustful of the system. They have significant psychiatric symptoms, and they're really representative of an individual in the care act, in the care system, that has a higher level of acuity, meaning that their symptoms are significant, their mistrust of the system is pretty high, and they actually have some levels of safety risk and sort of dangerousness in the world. With this person in particular, the role of the peer supporter might be to really develop that first line of contact, use their own personal experience as a way of sort of connecting with that person and helping Taylor feel like they're being heard and listened to in the system. And that peer role might actually help with the mistrust of the system, because the peer professional in this case might actually present a role, present their own history of working with the system and how that's been beneficial to them. The next person we're going to be looking at throughout this training is named Robin. Robin is already involved in a lot of supportive systems and really is just needing some help with new coping mechanisms, has some challenges around some increased substance abuse. and is looking for referrals to other agencies and connections. She was representative of an individual in care that has a moderate level of acuity, meaning that she is experiencing sort of mild to moderate symptoms of mental health issues, and is not really in a lot of danger, but actually could use a really good connection with a peer. The peer role in this situation might be to help develop rapport, help her think about what other options for services might be helpful, and maybe making some referrals, and even maybe helping that first step of connecting with other possible services like substance abuse services, community services, or more community and integration services to help her find connection with more individuals and people in her life. Then finally, Cameron represents a moderate level of acuity. They have chronic and long-term mental health symptoms, and they have difficulty communicating their needs to other people. Cameron has actually fallen off of the sort of treatment track and has not been really connected with treatment or services or traditional mental health systems for quite a while. And so with Cameron, the role of the peer might really be primary to reestablish that connection and help bridge the gap between Cameron and their connection to other services. So the peer, using their own history, their own experience, and their own life sort of trajectory as a model for Cameron, might help Cameron actually reconnect and engage with the systems and services that are available to them. Now we're going to look at the next role. As we talk about these cases, we're going to be looking at sort of what the peer role might actually be. So in the next slide, we're going to be looking at what the role of the peer actually is. So what is a peer? Let's start with that. A peer is, in this case, an individual who is self-identified as having lived experience with a recovery process, which might be recovery from substance abuse, might be recovery from mental illness, might be a combination of the two, or the peer might be a family member of a person who's been through that recovery process themselves. In both cases, the peer role is somebody that has used their own life experience to help others develop connections and direction in their work. And what is the role of the peer? Well, the peer can actually help to, as I said earlier, establish that initial relationship and connection, use their own life history to model how mental health services and care services have been helpful to them. They can prioritize a really strong supportive relationship. Before they think about treatment or intervention, they're really focused on the connection and the relationship with that individual or participant that they're trying to support. As that first line of connection, they're using their own cultural responsiveness and cultural humility. They're using a person-centered approach and a person-driven approach for mutuality and authenticity, and to help that person identify their own needs and advocate for their own needs within the care system, within their treatment team, and within the court system. The peer also maximizes the elements of the person-centered care by ensuring the client is able to express their self-determination, their interests, and their desires in the system, and it will help to represent that person within a treatment team if necessary. The main role of the peer is to understand and represent the voice of the client and the participant. Go to the next slide. Right. We're going to be looking at some of the evidence about why peer roles are so important. Peers can improve outcomes. Peer support has been demonstrated to save money in client care, reduce the need for inpatient services, increase abstinence, and help people with mental illnesses navigate the system more effectively. Here's a couple of quotes that'll help us get on the right track around this. From Mental Health America, peer support improves quality of life, increases and improves engagement with services, and increases whole health and self-management. Also, telling the personal lived experiences leads to a profound shift from telling an illness story to a recovery story. They go on to say that this involved an identity transformation from being perceived as a victim or a patient to a person who's fully engaged in life with various opportunities ahead. So let's look at a little bit of the evidence. These are all listed on the page, so I'm just going to be giving some highlights. Using a certified peer specialist as part of a treatment team actually saves an average cost of $5,494 per year per person, as opposed to using non-peer or traditional mental health staff. Patients who received peer support had a decrease of over 42% in inpatient services and nearly a 30% increase in outpatient services. So that means that they're less likely to get hospitalized and more likely to actually accept and seek out the treatment that's available on an outpatient basis. Literature reviews have found that peer support can uniquely reduce barriers that prevent individuals with serious mental illness from navigating and using the healthcare system. A study at the VA found that patients receiving support, peer support, had more improvement on patient activation measures, the knowledge, skill, confidence, and attitudes for managing health and treatment than those receiving more traditional or non-peer related services. And finally, using peer support specialists in respite services has actually shown a decrease in hospitalizations and led to an increase in savings in that area of almost $2 million per year. Let's go on to the next slide. Right. While we were discussing peer support more broadly today with regards to the potential scope of the involvement in care, we want to take a moment to speak to the peer support specialist role, both non-certified and certified as peers. There are different terms for the peer support role. SAMHSA refers to this role as a peer worker, while peer support specialist is also a common term, specifically within peer organizations and behavioral health agencies. Regardless, SAMHSA speaks to the broad range of peer support role that may include the following activities: advocating for people in recovery, sharing resources and building skills, building community and relationships, leading and directing recovery groups and educational groups, and also providing mentorship and setting goals and using their own life history as a model for recovery and for moving through the system. SAMHSA also notes that peer support roles may extend to providing services or training, supervising other peers at work and supporting with mutual support other peer workers, developing resource connections, administering programs or agencies so peers can actually work at a much higher level as well, and even educating the public or policymakers on the role of the peer. And with our next slide, we're going to be looking at a little bit more specifically what a Medi-Cal peer support specialist here in California is offering and how that's different. A Medi-Cal peer support specialist is a peer that has been certified by a county peer support specialist certification program. Counties can voluntarily opt in to provide this valuable resource as of 2023. 50 counties in California include peer support specialist services as a benefit in delivery services, delivery of systems. So what are the requirements for a peer to be a peer certified specialist? They have to be at least 18 years of age. They have to possess a high school diploma or at least a GED or equivalent. They have to have had experience with the process of recovery of mental illness or substance abuse disorder, either as a direct consumer of these services or as the parent, caregiver, or family member of somebody who has been a consumer of those services. One of the really important things about a peer specialist is that they need to be able to and willing to and comfortable with sharing their own lived experience with mental illness, with substance abuse, or with the recovery process. They must also have a strong dedication to the idea of recovery and really be committed to that as a philosophy. And they need to agree in writing to adhere to the code of ethics around peer work. The final details around becoming a certified peer specialist in California is that you have to actually have attended an 80-hour training that focuses on all the skills and competencies that we'll be talking about later in this session to certify that you have actually trained and experienced these skills and developed them. And finally, you have to do some volunteer work and also pass a certification exam so that you will become a peer certified specialist. One of the benefits of this training and going through the certification process is that you can actually potentially use Medi-Cal billing codes for providing different services like education, group support, or peer counseling on an individual basis. All of these services have a baseline of competencies and a code of ethics. Now I'm going to transition our talk to my esteemed colleague, Rachel Chambers, who will talk a little bit more about the competencies in more detail. Thank you so much. Thanks, Rachel.
Thank you, Dave. It was such a great highlight of the role of the peer And now we're going to talk about SAMHSA's core competencies for peer workers in behavioral health. I believe that they've set the foundation for really to guide the states on core competencies that a peer support specialist are supposed to be trained on and embody. As Dave noted, a peer is someone with lived experience who has been dedicated to recovery, and is open about sharing those experiences. SAMHSA's core competencies are guided on the fundamental principles of recovery-oriented, person-centered, voluntary, relationship-focused, and trauma-informed. And though that framework informs SAMHSA's core competencies, which you'll see on the screen, and that peer support specialists must embody. And some of these, they're on the screen, but I'll highlight a couple of them that I really believe hone in on some of the skill sets and competencies. The ability for us to share our lived experience, as noted, the ability to provide support and recovery planning, which is important, the ability to link to resources and services and supports, the ability to support other consumers in managing crises, the ability to work on a collaborative team and to provide teamwork, the ability to promote leadership and advocacy. Those are core competencies that SAMHSA has really set forth for peer specialists to really embody to support the person being served. Of course, California has their own core competencies, and there are links and other information to California's core competencies in these trainings. Next, we'll go to a case example to kind of hone in on what I was talking about, those core competencies. So as Dave noted about Cameron, Cameron has been disconnected from services. They're off their medication, as he noted before, and really participating in the process. Cameron has expressed some distrust for individuals in the care plan. So we believe that the role of the peer and how they can support Cameron really is because peers have the time and the space and the understanding to help engage and support in navigating Cameron throughout the system. You know, and the empowerment is really important. Peers can increase empowerment. That means increasing Cameron's voice and choice and treatment and the supports that Cameron is needing. The peers also really supports in communication, you know, going between that translation between Cameron needs and the systems that are surrounding Cameron. And finally, we believe that the peer support specialist really helps Cameron follow a person-centered, recovery-oriented treatment plan and support and helping Cameron understand those court processes. So we believe that the peer, in short, is a cost-effective solution that is really client-centered, self-determined, and really supports with helping Cameron connect to those services. And next, you know, we know it's great to have a peer support specialist, but we really think it's important for us to talk about the infrastructure that is needed for really to have a peer thrive and to be able to provide these amazing services that we had discussed. As it were noted, that in order to really fully leverage the value of peers on a team, we have to ensure that the workforce is supportive and that it provides an environment for the peer to survive. As you'll see on the screen, like there are 4 main points that we really want to hone on for really creating an environment that peers can thrive in to provide that world-class peer support services that we really want in CARE Act. First, we really want to highlight is the provision of supportive supervision, right, and groups. But we want you to know that peers really need supervisors that understand the value and the specific competencies of a peer. Of course, having a supervisor that is a peer is ideal, but you know, the most important point is really being able to empower that supervisor with strategies to oversee the work of the peer. And it is noted in our training that Cal Mesa actually has a 1-hour free training to support peers. And there's also a number of peer organizations that provide training on peer supervisors to really give you the specific competencies to really support the peer workforce and thriving with the provision of supervision. But some of the main other points we want to hone on is that supervisors of peers should keep in mind that we want to keep an environment that promotes holistic wellness, that provides a supportive space, that provides a space for open communication, self-reflection, truth, and integrity. Peers really want workspaces that really have that framework of hope, recovery, integrity. And then also providing infrastructure that has group support. Because peer work is personal and emotionally challenging, of course, like other behavioral health professions, we really believe that it's important that supervisors really promote the coordination of group processing meetings for peer support specialists to really focus on mutual learning, to be able to share a sense of purpose and disseminate new skills and information, and to process a lot of the things that are going on. As we know, with this population that's great in need, it's also going to take a toll on the people that are serving. So we really want to create an environment that really supports for processing. And then, having an infrastructure that really has clarity on the role of the peer. It's important to understand the value of peers and ensure that that role aligns with those strengths. We would hope that peers are not considered junior team members of the team, right? And they're not necessarily community health workers or case managers. It is important for teams to think through what the role of the peer really looks like, and treat that role as co-equal on the team. And that's really what we want to hone in on for that and clarity and role. And last, training and personal development is always important for any behavioral health and profession, but for the peer role, preparing the peer supporter with training is very important. We believe that although a peer cannot bill Medi-Cal or can bill Medi-Cal, but California has set forth really strong guidelines on competencies and training we believe that all peers should embody. So we believe that it's worth the investment for a peer that doesn't bill Medi-Cal and that a peer that will bill Medi-Cal for them to go through the Medi-Cal peer support specialist training. We want to next go to, now that we've set the foundation for what an infrastructure is, now we want to talk a little bit about what it looks like to recruit peers. Like, how do you have an organization that really supports in the recruitment of peers? So as I noted in the earlier slides, those core competencies are really important to guide the work of the peer, but we believe that it's also guidance for recruitment of peers, non-certified peers and certified peers. We believe that using those core competencies can offer examples relative to job postings, to how you structure interviews, how you determine the team structure, the whole gamut. So utilizing those core competencies to really support in the recruitment of peers will really be important. And we also know that there's a growing number of individuals that have the peer support specialist. So there's already a growing pool of certified individuals that are ready to meet the growing demands and the challenges that the behavioral health workforce is needing, particularly in the CARE Act. And we would really want to uplift HCI, which is on the screen, that provides access to free training and 6 months of job placement support, as Dave noted about the Medi-Cal peer support specialist. But that training with those competencies will really support in the recruitment and also the retention and I believe the increased outcomes and services if you have a workforce that is empowered and skilled with the certification training, with or without billing Medi-Cal. And lastly, I'd like to go to some ideas and action, just to summarize what that means. And I'm going to just speak a little bit and kind of want to bring in Dave in on the next half. But in short, as the screen noted, where are we seeing peer supporters working in the community? As we noted, peers can work across the whole gamut, the whole continuum of the behavioral health system, from wellness centers, psychiatric hospitals, jails, court settings. Peers can bring their lived experience to support the consumer with all their behavioral needs. Some of the best strengths of a peer is our ability to initiate engagement, build rapport, ensure patient-centered, client-centered care, and maintain therapeutic relationships within treatment. And now we're going to discuss, and Dave, you can chime in on some of the experiences that we've seen in that role. Go ahead. You want to go ahead?
Yeah, thank you so much, Rachel. I wanted to comment on one specific group that we've been running at Painted Brain that had a peer enter into the group as a co-leader along the way. We have a group that's running at UCLA's inpatient psychiatric unit. It's a weekly art group that is for the patients of one of their inpatient units. That group was running very successfully for about 3 weeks with a social work intern leading the group, leading the discussion, and also leading the art activities. In the 4th week, we added a peer leader as a co-leader to that social work intern. The peer leader shared a tiny little bit about his own history and experiences in the mental health system and his recovery. And immediately the tenor of the group changed dramatically because the participants in that group started also talking about their own lived experiences, their own recovery processes, and really opened up about sort of the challenges in that recovery. So that peer voice, the peer presence, really allowed the other members of the group and the other participants to open up and share about their own life experiences and really connect with this peer. So one really concrete example of how a peer worker can really change and alter and deepen the work that we're trying to provide for others. Thank you.
And just to add to some other ideas, we kind of want to focus on like, how have you found the work of peer supporters helpful? And one of the things we want examples that we've been hearing about peers in the area of family support and the impact that peers can bring in the peer and recovery perspective to families, that they can really bring hope and understanding to the perspective of the family, right? So we really want to just highlight that in addition to, really being able to bring your own experience, the family peer can really support and utilizing those experiences to really engage the family and support in the recovery process. With that, I'd like to move to the next section to really focus on the possible roles of the peer. And I'd like to turn it over to my colleague, Deborah Rose, to really hone in on that.
Thank you, Rachel, and thank you, Dave. It's a pleasure to be here, and I'm so glad to have the opportunity to hear you both speak and to highlight the importance of peers in behavioral health care. It's been my experience working with many organizations that peers are often more skilled and able to connect with individuals that we serve, bringing authenticity and mentoring and coaching to the experience. And so I'm so glad to be here talking about the importance of peers and services, and specifically in the CARE Act. If we take a look at the next slide, you'll see a very high overview of what are some possible roles that peers can play in the CARE Act. We've got a couple examples on the screen: a member of the behavioral health team, and that could be what a homeless outreach, a clinic, an ACT team, somebody who's providing direct services. We've got an example of a volunteer supporter, the role of a peer as volunteer supporter, a member of the court or of the legal team, the counsel team, and then a member of the organization that's providing peer and family support. I think what's important to know as we talk about each of these roles is that we're not limited by these 4 roles. These are some of the roles that we're seeing now, and we hope and we expect that opportunities for peers will expand as we look at the next year and the further development of the care court. Why don't we move to the next slide, please? So beginning with a peer as a member of a behavioral health team, as I mentioned, I think often partnering with peers as equals in the treatment planning and treatment service system is really essential, particularly for outreach and engagement, for one-to-one support, to help connect with somebody, to recognize a member that we're working with is more than just a series of diagnoses, but is an individual with hopes and strengths and preferences and goals, and really considering that aspect of the individual. Peers can provide a connection using their own experience to help individuals connect to care. And so that kind of collaborative experience combined with the education that peers can provide education based on their own experience that comes in the form of mentorship coaching, I think is an invaluable aspect when we think about how peers will be involved in providing support and recovery services to members who are involved in the CARE Act. Let's take a look at the next slide, please. So peers as volunteer supporters, and this is interesting because peers can play lots of roles. In this scenario, we're considering a person with lived experience serving as a volunteer supporter. Again, the volunteer supporter is an individual who is selected by the care respondent. It's somebody that he or she chooses to be part of their service plan and of the care plan. And in this scenario, a peer is using supportive decision making to help ensure that the person's voice is heard, that the individual's preferences, needs, goals are incorporated to the care planning process. And so it's less of an advocacy role and more of a supportive role. We're really maintaining neutrality and impartial judgment, I think, is an important aspect of that. And so we begin to see some of the different opportunities that a peer can play. We've talked about behavioral health treatment. We're talking about volunteer supporter. Why don't we take a look at the next slide, please? And we think about peers as a member of the court team. I think this is really, really a terrific opportunity for people to be involved, people with lived experience to be involved, to support individuals, the potential respondents throughout this process. Courts can be scary places. For most of us, it's intimidating and formal and frightening. And so peers, I think in particular, those with lived experience of having been through a court process can provide that beneficial support, coaching, mentorship, education to the individual receiving services. Who are the different roles involved in the court? What can be expected in the court process? How do you prepare for that? Certainly accompanying somebody to a court process and using the collaborative experience to ensure that that person's voice, again, I mentioned preference, opinions, needs and wants are expressed, being part of that ongoing court system. Also, though, providing an education to the court system, to the counsel and to the judges. What is it like to live through this experience with a mental illness, to go through the process of being involved in court, to help educate on some of the symptoms, some of the processes. So really being a collaborative partner throughout that entire experience. Let's take a look at the next slide, which again is a sort of fourth role that a person with lived experience, a peer support, can potentially play in the CARE Act. And this is as a member of a peer organization, very similar to what Dave and Rachel have shared with us, their experiences as a peer organization. And these are folks who either have lived experience and are trained to provide that kind of collaborative mentorship. Could be a family member with lived experience who are also trained to provide support to other family members. And what we're seeing here is really an opportunity to support individuals and families, to help provide education, explaining the process, being touch points throughout, and to communicate about the CARE Act, the eligibility process, the petition process. We're seeing that already peer support organizations are providing in-reach to other organizations. And so I think that there are a number of opportunities, not just the four that we've talked about in the future, we hope. They're not distinct necessarily. And when I think about the overlap that some roles may play, there's really many valuable moments where people with lived experience can support the treatment teams, the individual who has been identified, the people who are providing the legal structures. And so I think we have a great chance to look at additional opportunities moving forward. Maybe we can pause and take a look at the next slide, ideas and actions. And I'm going to invite Dave and Rachel to join me again to talk a little bit about what's been your experience seeing peers in some of these roles. And have you seen peers play other kinds of roles throughout the early stages of the CARE Act process?
Yeah, I'll just chime in and Dave can chime in.
Mhm.
I know that Deborah mentioned a pretty beginning exhaustive list of the role of the peer, but from the early stages that we saw in the CARE Act, as Deborah noted, a lot of peers have been engaging on the treatment team as early individuals that are of engaging the recipients or respondents of the CARE Act, and we saw that the peers have also been able to utilize the Medi-Cal billing codes to be able to support the treatment provision on those teams. So in the early stages, we've also have saw as well peer-run organizations, as Deborah noted, coming together to try to find additional funding to support the recipients of service in the CARE Act, as well as trying to identify ways to get the volunteer role, peer or volunteer supporter role, coordinated with the peer specialist role outside. So I know that there might be different areas in ensuring that the conflicts don't get involved. But I think that there are expansive roles that we've been seeing early on in the CARE Act, as I noted. And I don't know if there are other roles that other folks want to chime in, but that's what we've been seeing early on with CARE.
Thank you, Rachel. Yeah, thank you, Deborah. I want to just mention the impact of stigma around mental illness very briefly and talk about how stigma is such a major problem, both in the public sphere, but also in the court system and in the treatment system. People that work in the treatment system, when they interact with somebody who has a severe mental illness, it's usually when that person's in crisis or in a really bad place. And so what I think is so fascinating, what I've seen in my history with work in public speaking and in talking about mental illness, is that the peer role can actually be a role of education, a role of translation, and a role of sort of personal stories that allow both the public, but especially the treatment teams and the care team and the care court system to understand that a person with a psychiatric illness, you're seeing them at one moment in their time when they're at their worst. But a lot of people actually do move into recovery and actually can talk very articulately about their experiences, about their role, about their life, and about what it's been like to get treatment themselves. And so I think the educational piece that we mentioned briefly earlier is really another sort of unspoken role of the peer, that the peer professional is talking about their lived experience in a way that is truly transformative to members of the treatment team, the care court, and the public, in recognizing that people with mental illness go in and out of the severity of their symptoms and can have a full life and a full recovery. So I'd like to just add that part of it to this discussion as well.
Yeah, great comment, Dave. Thank you so much for that. Absolutely agree.
Thank you.
Why don't we move forward and take a look at the next slide? And I'm going to invite you both back in a moment. We've got some interesting content to cover. So let's talk a little bit about specifically integrating peers into the care process. We can move to the next slide. Here we have a very high level overview with lots of details about the care process, and I'm not going to speak about all of those details. There is additional information if you want to go to care-act.com to learn more about the petition, about the entire CARE Act process. But here what I want to do is give one message, which is there are opportunities and moments for involving peers in every step of the CARE Act process. Starting with the left side of the screen, we have the initiation. There's chances, as Dave mentioned, for education, for partnership. We move into engagement, and I think that outreach with coming from a person with lived experience who has had those moments in their lives, who understands what some of the challenges and the successes are in recovery looks like, is an important component to involving people as they're going through this process, certainly through every stage of court activities, and whether they're the various merit hearings or other hearings, to partner as a coach, mentor, educator throughout that, and then through ongoing recovery services and planning through graduation and perhaps after. So I think what matters here is recognizing that peers can play a valuable role in each stage of care planning and the CARE Act. What I'd like to do is just take a moment and go back to Taylor, who Dave described earlier, and use Taylor as an example to think about how would we incorporate peers and support services for Taylor as they enter care planning process. So quick reminder, Taylor's a 49-year-old person who's newly engaged in the process, seems to meet the criteria for care based on previous 5150, diagnosis of schizophrenia. Taylor has lots of hobbies and interests. We're not seeing on the screen is that Taylor is interested in knitting and is pretty skilled, has made a couple of blankets, and has a goal of raising chickens one day. So we know a little bit more about Taylor. At the moment, though, as Dave talked about, Taylor's a little distrustful of the system, is hearing voices that other people don't hear, and has some thoughts that kind of their mind is playing tricks on them. And so it's a difficult time for Taylor and for some other folks who are trying to engage Taylor into care. And so when we think about how peers might be involved, engaging Taylor in this process, and certainly Dave, if you'd like to pop in, I think that you can help address this. But we think about peers who use their own mutual experience of having lived through some of these moments that Taylor may have, using authenticity. It's very different having somebody with lived experience making that outreach than it is having a professional who's been trained in school. And then certainly using some supportive experiences, talking with Taylor, recognizing the strengths, recognizing the goals to help engage Taylor into services. Dave, what am I missing here that you can round out?
That was really great, Deborah. I think the only thing I would add is that the peer professional can come into a situation with Taylor and say, you know, I've been there too. I've heard voices. I have mistrusted the system. I have felt like I was being told what to do by my care providers. And I get it. And I'm here with you, Taylor. I've been through this, and I've also seen the benefits of actually allowing those people to help me out and connect with them, but I didn't trust them either, you know? And I think that mutuality and that sort of lived experience is what's going to potentially draw Taylor into accepting high levels of service, really starting with that peer voice and that peer connection. So thank you, Deborah.
Thank you. Let's move forward. I think we began to hit on the next slide, which is the role of peers in outreach and engagement. And I kind of jumped ahead of myself talking a little bit about how you can engage somebody. Dave, help me out here again.
Yeah, absolutely. I think that the peer role in outreach and engagement is really significant. People are very curious about mental illness, even though nobody wants to talk about it. And so I think that the peer, in their lived experience, in their comfort in talking about their own life and their own recovery process, is a conduit for people in every system to understand what people with mental illness are dealing with, what it's like to have psychiatric symptoms, and the fact that psychiatric symptoms are not monolithic. People have different experiences at different times. They can be very articulate. They can be very disconnected at different times. But a lot of the public and a lot of the even treatment providers don't really know that about peer work or peer life. So I think that presentation is huge. Another way that outreach engagement can happen through the peer is through sort of psychoeducation and group work. Peers can lead and pull together really creative art groups, really creative discussion groups, and really allow people to come together and talk about what they're dealing with by leading the way and using themselves as a model and as an example. The power of our own voice in talking about what we've been through, the power of the peer voice in talking about what they've been through is really the conduit, the key, the connector in all of this. And so the peer has a huge role in engagement and outreach and public education. Thank you, Deborah.
I think public education is the perfect segue to the next slide, which is about the role of the peer in the court process. And I really do want to kick off with education. It's an opportunity for a peer to provide education both to those professionals in the court system, the judge, the lawyers, etc., but also to the respondent. And so it may be about explaining to somebody the different roles, the care process itself, opportunities for recovery supports, what might be included on a care plan or a care agreement. I think that a peer can play a valuable role, certainly with an individual's consent, accompanying a person to court. If somebody is interested in that kind of additional support, I think there's lots of moments there that we can consider. Most important, I think that the peer involved in the court process is really about ensuring that the individual's voice is heard, that their needs, their preferences. I prefer this med over that med. I would like to get recovery supports here instead of there. It's important to me that if I have a pet, I find a home where I can continue to keep my pet. And of course, I'm making up examples. If we think about Taylor and Taylor's goal of wanting to raise chickens, right? Maybe Taylor wants to receive services in a more rural area so that they can work towards their goal. So I think that within the actual court process, it's both the output, that education, that support, but also ensuring that the individual's needs and preferences are understood by those who are overseeing the court process itself. Let's move to the next slide, please. And I did start to talk about peers in the care agreement or a care plan. I don't know that I need to go over that idea of ensuring that people's voices, wishes, goals, preferences are heard. I think that that's absolutely essential. We want to partner with the person, the respondent who is part of the care plan. And I think for a peer to be able to understand that, to use supportive decision making to help identify some of those preferences, to use motivational interviewing to help facilitate that process, and really ensuring that somebody's priorities and preferences are heard as a service plan is developed, as providers are identified. Perhaps somebody prefers services in a language of a choice other than English. Perhaps they prefer services in a group format versus individual. I think that really essential to involve the peer in part of that planning process. Also, since I'm talking about supportive decision making, we'd like to talk about the psychiatric advance directives, a really significant opportunity here to ensure that people's voices are not only heard, but are documented. And I'm going to ask Rachel to talk a little bit more about psychiatric advance directives.
Thank you, Deborah. The Psychiatric Advance Directive, as in statute, refers to incorporating a Psychiatric Advance Directive, a PAD, later in the care process during the graduation plan development, but it can be developed prior depending on the consumer's readiness and desire to develop one. A peer can be important in supporting in the development of a Psychiatric Advance Directive, and we have a specific training on the website that speaks specifically to best practices related to a PAD development, and we would encourage you to check that out. But for those of you in the audience that is new to a Psychiatric Advance Directive, basically, as it's noted on the screen, but it's a legal document that details a person's specific instructions or preferences regarding future mental health treatment. It's used to plan for the possibility that someone may lose the capacity to give or withhold informed consent to treatment during the acute episodes of a psychiatric illness. And it allows a person in a mental health crisis to retain their decision-making capacity by choosing trusted agents to advocate for their choices. And I just want to note, for someone like myself that has been diagnosed with a serious mental illness, a Psychiatric Advance Directive has really been key to ensuring that my preferences in treatment are really noted at times where I've had the capacity to give that decision. Specifically in cases for me, I've been on at least 10 to 15 different medicines. It's important that my Psychiatric Advance Directive highlighted which medicines did not work for me, which medicines I had very strong reactions to. If you have a pet, where would your pet go, as Deborah noted? Or if you have bills, what's going to happen if you go to a hospital? That's happened to me. Like, what was going to happen to my dog? What was going to happen to the bills? So a Psychiatric Advance Directive really outlines your preferences and wishes when you don't necessarily have that ability to do it, but it also can inform your current treatment. So both in crisis and just general treatment. So we believe that it's important to learn more about the Psychiatric Advance Directive. I also want to highlight that there is currently a multi-county innovations project that is working to make a website to digitize the Psychiatric Advance Directive and have the Psychiatric Advance Directive communicate throughout various systems of care, including with first responders, law enforcement, and hospitals. So if you're interested more about that project, I encourage you to check out our resources below to hear more about the project. But we believe, in short, that the role of the peer can be key in supporting the recipient and having the Psychiatric Advance Directives outline and documenting their preferences and wishes during a crisis situation. And we believe the Psychiatric Advance Directive will be key to helping the respondents and care maintain their recovery to whole health. And so now I just want to turn it back to Deborah.
I'll take it, Rachel. And I want to quickly mention, thank you for highlighting how important that document is. I think it's really an essential part of recovery planning. For those who would like to learn more, there is additional trainings that are on our website, care-act.org. I think I had said .com before, so let's make sure that I get it right, care-act.org. And there are specific trainings on psychiatric advance directives that you can find there. So let's go to our next slide, please. And this is a quick reference back to Robin, and I believe that Dave talked about Robin earlier. Robin's 62 years old, has been part of care for 6 months, has generally been really doing very well, supported by a peer support specialist, supported by a physician and an entire treatment team. But it's been a little bit of a difficult time for Robin. There's been a loss in Robin's life, somebody who mattered to Robin, and as a result of having a difficult time, Robin's having a hard time abstaining from alcohol and isn't doing so well. So when we think about what kind of supports might be provided by a peer at this point, less of acuity needs than we've seen with some of our other scenarios. This may really be about partnering in care, helping to identify some recovery opportunities like self-help groups, like a treatment setting. It may be about lending a supportive ear and some mentoring. I've been through difficult times. This is what it was like for me. How can I help you identify wellness opportunities for yourself to get through these difficult times? Going back to that sort of spectrum of need that we've given a couple different examples, Cameron, now Robin, we think about peer opportunities and how somebody with lived experience can support Robin through the CARE Act. And it may be a less intensive, just rapport, mentoring, partnership that will provide really an essential component to recovery. Let's go to the next slide. Where we have our 3 scenarios here. Taylor, Robin, Cameron, we've talked about them a bit. Dave, Rachel, I'm going to ask you in a moment to just reflect back a little bit on what are some of the different ways that you think peers could be involved when we consider somebody's needs along the spectrum from more intensive to less intensive. Maybe you could tell me a little bit about how you think that a peer can support these individuals.
Absolutely. I think that in every case, the use of person-centered language, the use of the personal story and the personal recovery experience is going to be really key to connecting with these individuals and helping them possibly feel more connected or more accepting of treatment options. The role of that changes in terms of the level of acuity for the person. So as we said, with Taylor, who might be having more severe symptoms, the personal story of the peer who's talking about their own lived experience, their own severity, their own mistrust of the system might be that connecting force and allowing Taylor to actually possibly accept higher levels of service or care because they're allowing the peer to give their model and their experience and live that lived recovery experience. With Robin, who Deborah just mentioned, I think that the peer, unlike the treatment team, is going to have a lot more time and attention to spend with Robin around the loss that they've experienced. Probably has experienced their own losses, and because of being in a peer role as opposed to a more traditional clinical role, is going to be much more potentially open about their own loss and their own recovery experience in that part of their life. So that's going to be really key. And
Yeah.
then with Cameron, I think that the time, the attention, the personal story again is really important. But with Cameron, it's really more about like accepting the fact that care providers actually do have something to offer. So that personal story about what they've been through and how they've come around to actually thrive and grow in their life, and how the role of the care court or the mental health providers have been a part of that recovery is going to be really key to helping Cameron sort of dial in and reconnect and maybe accept some higher levels of support and care that are available to him. Rachel, I wonder if you have other thoughts about how the peer might be a really important role and connector in these individual scenarios.
Yeah, I just think that you hit it like right on the nail, because the peer plays, like you said, a major role in engagement, and supporting that client person-centered treatment plan to promote recovery. And just and I'll kick it back to Deborah, but just one note, but just as a person with a severe mental illness, that like they've noted early in the training, like there are times that, we can thrive, and that at times that people in care will see individual with serious mental illness is when they're at their lowest, or probably experiencing the most symptoms, and that recovery is possible, and that the peer support specialist, in my case, really provided a sense of hope in your lowest, darkest times, even in the courts, that recovery is possible and that you can thrive. And I believe that that's what the CARE Act and peers in the CARE Act can really promote: recovery, wellness, and supporting individuals in thriving. And we'll just let you close it out, Deborah, with those other ideas.
I would like to say thank you to both of you. I really appreciate your time and you being here. I appreciate partnering with you and learning from you. And so thank you very much for including me and for joining me. And I'm going to turn it back to Patricia.
Thanks to everyone for sharing their thoughts, the participants for also joining and learning more about the role of the peer. Again, just to recap some of our learning objectives. So the goal is that by the end of the session, you will have a better ability to identify best practices for incorporating peers into the care process, identifying those ways in which peers can be incorporated, and listing strategies and resources available for peer support specialists and other peers participating. With that note, I'd like to share some additional resources. Some of these were mentioned in the training, but some specific guidance around peer support billing resources. We have a number of resources listed here, which you can find in the PDF of the training materials, where you can go and learn more information about billing for peer support services. And then on the next slide, I wanted to share some other resources that are available, including peer support groups, and more information about how peers can be incorporated into specific care for individuals with schizophrenia. And then just wanted to highlight some next steps. Deborah mentioned our website, where we include recordings of past trainings, including this training, which you're viewing now. And so you can go there and look for more additional resources. If you're not currently signed up to receive communication emails from the CARE Act team, please click on that link to join that. You can receive information about upcoming trainings, resources that have been released, and other training and technical assistance opportunities. In the meantime, there is no wrong door, so we wanted to highlight our email address, info@careact.org. There is no wrong door, so if you have a question about implementing the CARE Act, or you need to be connected with specific resources or want some more information, please email us there and we will get you to the person with the right information. So again, I wanted to say thank you to my colleagues who presented and shared their experience, and thank you all for joining. Thank you so much.